A 45-year-old male approaches me for some help with some medication side effects. This man is schizophrenic, a paranoid schizophrenic who has a lifelong history of schizophrenia since age 4, with a lot of non-compliance with taking his medication. A lot of people who are schizophrenic don't like always to take their medication. It has unpleasant side effects for them. This is a case in which his constitutional state is not something that particularly we need to know about. We're not treating his constitution directly. At least that was my understanding of this case when I set out to try and understand what he wanted help with. So the medication side effects that he reports are a heaviness, a drowsiness, a lethargy. As soon as he is injected, which he receives every 2 weeks, loss of all motivation, higher reasoning, higher thinking ability, loss of all creativity. He has difficulty getting out of bed. He literally appears drugged, and you might even say drunk. He becomes uncoordinated and clumsy, and he loses 3 or 4 days of every 2-week period to this medication, which he finds extremely unpleasant, but he's forced or obliged to take. So in my thinking, I didn't look at him constitutionally. I just looked at what he reported as side effects of the medication when injected into him. And I took that as the case. I subsequently thought, after the remedy had been given, that the two, his constitutional state and some of the drug symptoms, may actually be confused and mixed up together. I couldn't really tell. But not having taken a case history of his constitution, I couldn't be sure. In any case, I set about trying to treat the drug side effects as he reported them to me. I gave him Theridion, which worked only briefly. I used a spider venom because I thought nervous system is what we're treating, and the blood. The route of entry is into the blood when this medicine is injected into him, and its target is the nervous system. So I set about using a snake venom secondly, and the remedy I used there was Hydrophis cyanocinctus, 50 m. He was given that to take at 48-hour intervals for 7 doses and then asked to stop. Within 10 days he had reported back to me to say that his symptoms were very much improved. Actually, as he appeared to me, he was extremely alert, fairly happy and relaxed looking, and he said that it had had a big beneficial effect on preventing the worst aspects of the side effects taking root in him. So more alert, more able to deal with the side effects, and as another subsequent benefit that I found out from him, the medication also causes muscle spasming, quite painful and severe spasms in tendons and muscles. That had completely stopped. He said he hadn't had any for that 10-day period, and as we speak now, we're now a month into treatment. He's using Hydrophis cyanocinctus only at the time of his injection. Around that time he takes a couple of doses to offset the side effects of the injections, and the spasms have gone, and he appears much more alert, much happier, much calmer in himself. You might also consider Hydrophis cyanocinctus in cases of shingles, for obvious reasons again, the nervous system. Think about it there as well.